I've been asked to tell you just a little about this new plan for better health. Our plan is a service which will provide the best medical advice and treatment for everyone.
The NHS turned 70 this year, and here at Manchester Metropolitan we couldn't be more proud in helping them celebrate this very important anniversary. We're very proud of our close working relationships with our NHS partners in preparing our graduates to work in a 21st century NHS. Most importantly, we're very keen to put people, families and communities at the very heart of what we do.
The importance for Manchester Met and Pennine Care Foundation Trust to work together in a strategic partnership cannot be underestimated. The partnership informs everything we do, from teaching, from research, from continuous professional development programmes, and we work with all staff across the NHS, and then we can help shape their knowledge, skills and understanding so that they're better prepared when they're in employment.
Coming together in partnerships is the best thing that the health service can do. An example is the Clinical Sciences Centre of Pathology at the Manchester Royal Infirmary, and it's one of the best pathology diagnostic centres in Europe and possibly in the world. They are now providing blood cancer diagnostics for the whole of Greater Manchester, so patients will get the best diagnostics they can possibly get. I served in the NHS for 53 years. I was fortunate to be awarded a Lifetime Achievement Award in the NHS, and it's the first such award in pathology. So you can imagine, I was absolutely gobsmacked.
I won the National HIV Nurses Association award for my outstanding contribution to the field of HIV nursing. My recent research looks at psychological care for people living with HIV, which is a massive area within the disease, and that research has then been embedded in some national guidelines which advocates a more person-centred approach to delivering HIV care.
Manchester Met is the sole provider of the academic component where all clinical embryologists and andrologists are trained in the UK. It has a long history of providing biomedical scientists to the NHS workforce.
The Royal College of Nurses has highlighted that we have 40,000 vacancies within the UK. So it is vital that we do something to recruit and retain the staff we've got. There is so many positive things about being a nurse. It's such a privileged position. The way that you touch people's lives are, it's immeasurable.
I'm returning to nursing now, having worked alongside the NHS in a slightly different role for many years. One of the things, I suppose you could say, I was fortunate, if you will, enough to work alongside the victims of the Manchester bomb, working with the doctors and the nurses and all the other associated professionals, and to be able to see what they were doing for the patients. I really wanted to get back in and get hands-on with that, and they sort of inspired me to come back into that.
So I would like the NHS to continue always striving to be better, always thinking beyond the usual standard of care and always evolving.
So for me, the NHS is the greatest institution that we've got in the UK, and I think we need to fight to keep it going.
For me, the NHS is a world-class organisation. It's somewhere where people can come to be safe, to be helped, to be treated. It's welcoming.
For me, the NHS is the best of British society, the very best of British society.
Regardless of your wealth, it should be free at the point of.
For me, the NHS is so important to the UK.